Good morning, and thank you for coming back to this channel. Okay, big shout out today for NuggetMaate. Thank you very much for sending in your question. Okay, there's a lot here you're asking, so I will try and go through a little bit by each time. And if I don't answer the questions, my apologies. Just remind me what you need me to ask. So, hi Fred, just wanted to, if you could possibly help me out as a newly qualified ECA, perhaps do a video on what makes a good ECA from your time in the role. That's a brilliant thought for today, so I shall do that. As you probably know, it can be fairly overwhelming straight after training, knowing what is expected of us and some tips about how to settle in the role quicker. Things like what's expected of us, simple tips on what we do on arrival and where to stand, that sort of thing. Right, so there's quite a general question about what do you do? You're an ECA? What do I do? I think that's what I'm going to turn this one as. Sorry, that's Dracula back. Hello, Drax. Okay, so you passed your exams, you passed your tests, and you are now an ECA. Okay, so that's the biggest thing you've done, and a big congratulations that you've got to that point. Okay, your first day and the subsequent, I suppose, 3 to 6 months maybe. So don't let that worry you. First of all, is that you're going to feel as green as your uniform. You're fresh out of college or the training package you're in, and you'll go into station on your first day and you're told, okay, so this is your crewmate for today. If you're on a rota, or if you're lucky enough, here's your line, which means your relief worker, so everyone changes every time, or your rota, which is the person you're staying with for at least sort of 3 months onwards. Generally speaking, ECAs will be on a working relief. So they'll change different paramedics to work with, different stations, different trucks, different shift times. It just basically allows you to find out who you're working with, what they're like, the general idea of what each station's like, different working shift patterns. It's a really good way of getting your feet under the table, have a feel for everything, because every paramedic is different in the way they work. Eventually you might find a paramedic you work really, really well with, and they like working with you, and you can be you can then think forward and say, okay, well, this paramedic prefers to do this way and this way and this way, and then you can preempt it and then work with them. But you won't have that connection at the very beginning, which is why they prefer to put you on, I mean as in the trust prefers to put you onto a relief line. So you work with many paramedics and you get an idea of how each works. So a good ECA is somebody who can preempt what the paramedic requires. For example, you go into a house. As you walk up to the house, a good ECA would already be thinking about, if I've got to take this patient out, is the walkway back to the truck, is that clear enough for a chair or a stretcher, for example? Okay, so as you're walking up to the place where the patient is, whether it be outside or inside, if you're using stairs, is there a lift? Does the lift cater for a stretcher or just a chair? Is there no lift at all? Would you think you need to have your chair with tracks, which are the ones that help you go down the stairs? So these are the things I start thinking of straight away as I'm walking up to the patient's location. You get to the patient location, of course you do your scene safety situation straight away, make sure there's nothing that can be detrimental against your health and of your paramedic. Usually the paramedic will go in first, but if your turn to look at the patient, then you generally go in first. If the paramedic is very good with explaining themselves and thinking out loud, you can kind of figure out what they want. They might say, oh, you know, let's have a plan. Let's see how we go on through this, and this. I'm just going to do these obs on you. If we find that your blood pressure is higher, then you're going to be going into hospital. So, for example, and then you keep an eye on with the blood pressure, and you find out that the blood pressure is higher, for example, then the paramedic's already told you this person is going to hospital. So your thought is, okay, let's think about how am I going to extract? Do I need a chair? Do I need a stretcher? Can the patient walk out? If the patient can walk out, brilliant, because it helps our backs and everything else. Okay, so have a think about what the paramedic's telling you, and even before you get to the patient, speak out loudly, say to voice your thoughts to the paramedic, saying, you know, can you let me know in some subtle ways that what you need, you know. The paramedic may say, okay, well, I just wanted to put a little cannula in your arm, and so you know it's going to be either going to be given a drug, or it's going to give a liquid, some saturation of sodium chloride or something like that. So straight away, get to the green bag, get out the cannulas, or at least get out the wipe and the Vecafix and gauzes and things like that. And then when you're ready, you can say to the paramedic, okay, when they've sorted out the arm, what colour would you like? And then the paramedic will say, oh, well, I'll have a pink, or I'll have a blue, or, you know, and then you're ready already with that cannula. But it's just preempting what the paramedic's going to need. But you won't get that until you've been on the road for some time. And I mean some time, I mean like 3 months or so, at the very minimal, okay? So please don't worry about, oh, it's taking so long for me to think of what to do and how to be a good ECA. I'm over 2 years now, and I still, you know, I'm still learning. I'm still thinking that, you know, I should have preempted something. But it all depends on the job. It all depends on the paramedic. It all depends on the patient. It depends on you. You might be feeling a bit rough that day. You might have a bit of a cold, or you're hungry. You need to go to the bathroom. You know, your mind might not be on the job at that time. So try and go through scenarios in your head, at home, you know, and think, okay, if it came across, I don't know, a car crash or something like that, what would I be doing? And maybe speak it out to the paramedic, say, what would we do in this situation? But the best thing is, don't treat until you see the patient. Okay, there's so many things that comes up on the machine on the ambulance to say, oh, okay, we've got a possible arrest, or we've got a possible I don't know, asthma attack, or, you know, sometimes that information is not correct. It gives you an idea, but treat what you see, don't treat what you read, because otherwise you'll go into a job with premeditated ideas, and it can be completely wrong, completely different, and that will throw you, okay? As my old colleague used to say, and still does, keep it simple. Thanks, Martin, for that. Keep it simple. Don't go ahead and start thinking about, very difficult scenarios and things like that. Stick at one thing at a time. If you need to know the numbers of the cannulas, how big they are, go and learn them. There's only like 5 of them, yeah. So that's my sort of take for that. When you settle in, it takes a while to settle in and find your feet, okay? Whatever you do, don't try and rush things. Take things slowly, keep it simple. Take things slowly. Treat every day a different day. Every day's a learning day, okay? Now, when you first start up, the first 3, 6 months, even a year, you're going to think, oh, crikey, you know, I can't remember this. Where's that? Where do I put that bag? Where do I need to pick up a bag valve mask if he needs it? Where's the oxygen? Where's the linen? What I do every single morning, or every single time I start the shift, go through each of those bags. One, it's great anyway because you're helping the paramedics make sure that everything is in place. And two, it keeps it in the noggin. So when you come to a point where you really need to have a ventilation, to have, I don't know, someone's having an asthma attack, you know, where do you get the mask from that? And where is the Ventolin, for example, the drug for that? So go through the bags and you'll find out slowly, you'll remember. And if you can't remember, say, oh, sorry, buddy, whereabouts was it? Which bag was it? Or where can I find this for you? And slowly and surely you'll learn, okay? So that's like a simple tip really as well. Yeah, just keep it simple. Make sure that if something doesn't go in your head and it doesn't stick for whatever reason, I know, you can't remember what's in the trauma bag, for example. We rarely use the trauma bag, the black one, which is in the big red bag. Remember that one? Okay, so if you can't remember what's in the trauma bag, look inside it. Have a sort of a try and check your memory, thinking, oh, what's in there? Oh yeah, there's a tourniquet in there. There's a couple of sort of army patches in there for chest compression. You know roughly what's in there. You may not know everything. Yeah, what's in the maternity bag? Where's the maternity bag? If there's going to be a baby popping out. Yeah, just take it one step at a time, and in time, your confidence will grow. Someone like me, I had no confidence in that sense. I was really, really, really nervous. And yes, as green as the uniform I was wearing, I just felt like I was a fifth wheel or something. I went into the station. I looked around tentatively. I didn't know anybody. I wasn't sure where to sit. Didn't know who to speak to. But be yourself. Be friendly to everybody. Smile at everyone that you come into the station. You know, they will remember you by the deeds you do. They will remember you by the way you speak to them and how you act to them. If you act up and become a silly, annoying person in a way of mucking around, which I'm sure you won't do, but think of a 10-year-old mucking around under a table like my boy does at school. They'll remember that, and they won't have the trust and the professional attitude towards you. But the more they work with you, the more that you show you're willing to learn. That yes, you're going to make mistakes. Everybody does. Even paramedics make mistakes. Okay. The point is, if you have a mistake, you learn by it. Your second mistake, then you have to learn by that one really, really well. Okay. But above all, communicate with your paramedic. Talk about everything. Talk about what the last if you just had a job and you just finished up and then he was doing notes or she was doing notes, and you've got like a couple of minutes before the next job, talk about it. What went right? What didn't go right? What didn't go right? What were you nervous about? What were you worried about? What could you done better? I've always asked my paramedics at the end of the shift, is there something I could have done better? Is something I should have learned a bit more? Is something could have did I do well? Think of the positives as well as the negatives. But there's no negatives when you're learning. It's all learning. Okay. I hope that helps you at all. I'm still around as an ECA. I'm still trying for the paramedic course. But, at the end of the day, the job of an ECA is brilliant because you are there to assist the paramedics. And then when you are doing a double ECA on a PSV, sorry. Then you will learn a lot very quickly. You'll learn how to use the data, the tough pad, but learn with the ECA that you're with. If you're two brand new ECAs, great. You've got a call. You can call a friend. There's so much help out there. All right. The best thing to note is that you're never alone. You're always with somebody. Somebody's always at the end of the phone or the end of the radio. You've got your paramedic who will then protect you as well. But on the other side as well, you're protecting your paramedic as well. So you're looking at, is there any possible dangers of, or problems extracting the patient and things. All right. Okay. I hope that helps. thank you again for that question there, Nugget, and I will catch you later on. This is getting better. This is my sort of second week, so stitches haven't come out yet. They'll be coming out at the end of the week, and I'll show you the scar if you really want to. All right, take care, stay safe everyone, and I shall see you soon. Bye for now.